Pregnancy can be both an exciting and overwhelming time for women. With a little bit of planning, preparation, and knowledge, you can make your pregnancy journey more enjoyable and easier. Here are some tricks and tactics that can help you have an easy pregnancy. Start with healthy diet. Eating a well-balanced diet is essential during the pregnancy. Incorporate plenty of fruits, vegetables, whole grains, and lean proteins into your diet. It is also important to stay hydrated and avoid sugary and processed foods. Exercise regularly. Regular exercise during pregnancy can help improve your mood, increase your energy levels, and make labor and delivery easier. Aim for at least 30 minutes of moderate exercise per day, such as walking, swimming, or prenatal yoga. And get enough rest. Getting enough sleep during pregnancy is crucial for your health and your baby's development. Aim for 7 to 8 hours of sleep per night and take naps during the day if needed. It is very important to take your prenatal vitamins. Prenatal vitamins are essential for healthy pregnancy. They contain essential nutrients like folic acid, iron, calcium, which help prevent birth defects and promote healthy development of your baby. Manage stress. Stress can have a negative impact on your pregnancy. Practice stress-reducing activities like meditation, deep breathing, or prenatal yoga to help you relax and manage your stress levels. Stay hydrated. Drinking enough water during the pregnancy is essential for your health and your baby's development. Aim for at least 8 glasses of water per day and avoid sugary drinks. Educate yourself. Read books, attend childbirth classes, and talk to your healthcare provider to educate yourself about pregnancy, labor, and delivery. Knowing what to expect can help you feel more confident and in control. Do not hesitate to ask for help. Pregnancy can be physically and emotionally demanding. Don't be afraid to ask for help from your partner, family, or friends when you need it. Knowing your ovulation timing is an important tips for getting easy pregnant. Knowing your ovulation timing can help you determine when you are most likely to conceive. Ovulation occurs when a mature egg is released from the ovary and travels down the fallopian tube. This typically happens around day 14 of a 28-day menstrual cycle, but can vary from woman to woman. There are several methods to track ovulation, including tracking basal body temperature and using ovulation predictor kits, or tracking changes in cervical mucus. Have regular unprotected sex. Having regular unprotected sex during your fertile window, which is typically a few days before and after ovulation, can increase your chances of getting pregnant. It's recommended to have a sex every day, other day during this time, to maximize your chances of conceiving. Here are some food recommendations for an easy pregnancy. Fruits and vegetables. Fruits and vegetables are rich in vitamins, minerals, and fiber, which are important for healthy pregnancy. Aim for at least 5 servings of fruits and vegetables per day and choose a variety of colors to get a range of nutrients. Whole grains. Whole grains like brown rice, quinoa, whole wheat bread, and are good source of fiber, can help prevent constipation during pregnancy. They also provide essential nutrients like folate and iron. Lean proteins. Protein is important for fetal growth and development as well as for the maintaining your own health during the pregnancy. Choose lean source of protein like chicken, fish, tofu and legumes. Dairy products. Dairy products like milk, cheese and yogurt are good source of calcium, which is important for the development of your baby's bone and teeth. Choose low-fat and non-fat dairy products to avoid excess saturated fat. Healthy fats. Healthy fats like omega-3 fatty acids are important for fetal brain and eye development. Sources of healthy fats include fatty fish like salmon, nuts, seeds and avocado. Here are some tips for exercising during pregnancy. Consult with your healthcare provider. Before starting any exercise program, it is important to consult with your healthcare provider to ensure it's safe for you and your baby. Your doctor may provide specific recommendations based on your individual needs and medical history. Always choose low-impact exercises. Low-impact exercises like walking, swimming, and prenatal yoga are generally safe and effective during the pregnancy. These exercises can help improve your mood, increase your energy levels, and promote overall health and wellness. Avoid high-impact and contact sports. High-impact exercises like running and jumping can put stress on your joints and pelvic floor, which can be uncomfortable or even harmful during the pregnancy. Contact sports like basketball, football, soccer should also be avoided to reduce the risk of injury. Stay hydrated during the exercise. Drink plenty of water before, during and after exercise to stay hydrated and avoid overheating. Listen to your body. As your body changes during the pregnancy, you may need to modify your exercise routine to accommodate your growing belly and changing needs. Listen to your body and adjust your exercise intensity and frequency as needed. Use proper form. Using proper form during the exercise can help prevent injury and make your workout more effective. Consider working with a certified prenatal fitness instructor or personal trainer to learn proper form and techniques. Avoid exercise that involve lying flat on your back. After the first trimester, it is important to avoid exercise that involve lying flat on your back for extended periods of time, as this can reduce blood flow to your baby. However, it is important to remember that getting pregnancy can take time and there are many factors that can affect your fertility. If you are having difficulty getting pregnant, it is best to consult with your healthcare provider for further evaluation and guidance. Thank you very much for listening this video. If you feel the video is helpful, please do subscribe and click the like button. Thank you.